what's kept me up the most at night. It's not just looking at the research papers and the journal articles and trying to find even the obscure preprints before they make it into, major news, and which can be interpreted sometimes not exactly as meant to be in terms of the messaging, but then distilling it for social media. And at the same time, looking at what others are putting out on social media. For pregnant patients, what's been, you find so far, the biggest challenge in terms of things you've had to debunk for your fellow patients, friends, and followers on social media?
I think what I've tried to get across to my pregnant patients is that we just don't know a lot of things. I think that when you look at the timeline of COVID as a virus that started in December of 2019 in Wuhan, China, and has since spread all over the world, someone who was pregnant in Wuhan, China at the beginning of their pregnancy in December has not delivered yet. So we just don't have a lot of answers. Yes. I think one of the things that is most difficult for me is that it's hard to provide true reassurance because we don't know. A lot of what we think about COVID, we're extrapolating from other viruses like MERS and SARS. We're extrapolating for what we think a high fever can do to a pregnancy in early pregnancy, but we just don't know with COVID because the time just isn't there. So I think what I try to do is I try to share, this is what we know, this is what we don't know, this is what we are hoping to learn, and just try to put them at ease in that way. I think that also what I've seen a lot with pregnant women is that you have a spectrum of actions of what you can do. If you're pregnant, you can lock yourself at home, not talk to anybody, not leave your house, not exercise, not walk, not get fresh air, and you're probably not going to get coronavirus if you clean your groceries and do all of that. You could be totally careless, go out without a mask, shake hands, lick the subway. You're probably going to get coronavirus.
Yeah.
And there's a lot of things in the middle. And a lot of people who need to live a normal life, a lot of people who are pregnant and need to work to make money to survive are feeling guilt and are feeling like by going about their life, even if they're very careful, they might be putting their fetus at risk. And I think that's a big challenge in an era where we don't have information. So I think explaining what the risks are, explaining how to be cautious, wear a mask, wash your hands, minimize contact, don't shake hands, don't touch buttons, and do certain things that are common sense. And if you're doing everything correctly, but you need to go to work to provide for your family, that's what you need to do. And I think understanding and helping them decide what it is what I try to do. I think from a social media standpoint, I'm not their physician. I'm just trying to help them. I think that's a conversation that needs to happen in the patient room with their own physician and in a case-by-case basis. So that's what I try to do, to educate and empower them to ask the right questions and make the right decisions for themselves.
I agree with you there. And I think, the more we get the messaging out, the more we can actually not just empower patients, but we are also empowering some of our colleagues who may not have the time to do the reading, to look for the obscure pandemic video that runs viral all of a sudden. And so somebody needs to be out there to, clarify things. But I also think it highlights a lot of what we really frustrates us, which is we don't know. And when it comes to obstetrics, when it comes to pregnancy, knowing is a big part of what arms us with information. So I would imagine with you guys being in an academic center, you are also challenged with, well, how do we know? And it sort of brings up the question of research. How do we study this? I've had a lot of patients reach out to me who've said, well, Dr. Duke, do you know of anybody doing research? Is there no one looking to see whether or not this is going to affect pregnant women? And I say, well, some people in China are studying things, but our Chinese patients still may be different from patients in the United States, which is a very diverse country. Or, like we're seeing with COVID right now, we're seeing differences in just how the disease is manifesting in the US compared to the other big places that were hit, which included Wuhan, China, and Italy. So how do you guys address that? what do you do to start to get to that part of we don't know?
Yeah, so we work collaboratively to incorporate all of the research that's coming along. We are lucky in that our infectious disease group is able to pull together a lot of those resources for us. The big UCSF Academic Center has weekly webinars where we go and sift through the data. We try to understand who's at risk, what kind of population is more susceptible, who's more likely to get hospitalized. So, for example, we know that males who are older, obese, and have uncontrolled diabetes are more likely to be affected and harmed by the virus long term. So we are basically trying to understand why, and
Right.
that's the part that's missing. We're testing therapies at UCSF, so there's different therapies that we're learning have an effect on the virus. A lot of the data that we have is anecdotal, and you have a PhD in this, so you understand this really well. It's really hard to make conclusions based on observational studies because we don't know what would have happened if we wouldn't have given the drug to that person.
Right.
In order to understand whether a drug works or what happens to a person, we have to test it against the alternative. So we have to give drug A to a person and then give nothing to the other person and get a sense of what happened. And when we do that over and over and over again, we start to see patterns.
Yes.
And even though we have some data that some drugs might help or might not help, we still don't have good data on randomized controlled trials of what's happening there. So I think that's something that's going to start coming over the next couple months, and we'll hopefully get some effective therapies. I know a lot of people across the globe are working on this. I think one of the things is that this pandemic has done is that it's brought the scientific community together. Countries may be drifting apart and politicians may be drifting apart, but scientists and physicians are coming together all over the world to try to solve this problem, because it's not, a Democratic or a Republican or a black or a white problem. It's a humanitarian crisis, and scientists and physicians are the ones that are at the forefront trying to fix the public health emergency.
And I'm glad you said that, because for me, it's been, I say, one of the biggest heartwarming outcomes that I see coming away from this pandemic is the science world has come so much closer. I've seen people conceive and execute studies in the fastest turnaround I've ever seen. I've seen places now have access to studies. When we think of, for example, the WHO Solidarity Study, which is a randomized study being done around the world with drugs that otherwise would not have been made accessible to third world countries, to people of color who typically didn't really have access to certain medications until long after they were